The next question, the member for York South-Weston.
Thank you, Mr. Speaker. I have stood in this House. My question is to the Premier. I stood in this House many times speaking about how my community of York South-Weston has been neglected and left behind in this government's COVID response. It took until September 28 of last year to get a COVID testing facility in York South-Weston. Our community is once again anxiously awaiting a permanent facility, a vaccine facility in my riding. My office has been involved helping Humber River Hospital with pop-up clinics at senior buildings. Now I hear reports from families that the government pop-up rollouts in our community is being met with chaos and confusion about when, where and how to get registered or book an appointment. When is the government going to get its act together and realise Ontario is not doing great and everything isn't fine? People's lives are at stake.
Again, member for Eglinton Lawrence, parliamentary assistant.
Speaker, and thank you to the member opposite for the question. Our government has been clear our vaccine rollout is focused now on phase 2, older adults and those at risk of serious illness and those in hotspot areas, like the member opposite's community. We also know that COVID-19 has disproportionate impacts on certain neighbourhoods like your community across the province, and we understand that administering vaccine to people who live in these areas is critical to reducing the impact of COVID-19 as quickly as possible. I was at the opening of the Downsview Arena Vaccine Centre with Humber River. I understand Humber River is working with the Black Creek Community Health Centre to set up a immunization clinic going in, and I read about immunizations happening in your community in the newspapers recently. We're doing everything we can to ensure that vaccines are being delivered and administered in your community, and to make sure that people get the vaccines as quickly as possible.
The supplementary question.
Thank you. My question is again to the Premier. Folks in my community over the ages 18 and above cannot book an appointment in our own community. I quote the Premier, Ontario is not doing great. Now, everything is not fine. In fact, this government is always a day late and dollar short in its COVID response. Hotspots and high-risk communities like York South-Weston are treated like an afterthought instead of an urgent priority. Why this inequities, and why are our residents, those essential workers and seniors, not getting equal access to vaccines from the government? When will you fix your pop-up organisational mess, and when will York South-Weston receive a permanent vaccine facility?
The parliamentary assistant.
Thank you to the member opposite. Thank you, Speaker, for the question. It's really everybody is getting vaccines as quickly as we're able to deliver them. The number one issue is how many vaccines are available, and we're still having some issue with supply coming in from the federal government. As soon as we have more supply, we get those vaccines out to people. Your community is a hotspot area. It's been identified as such. Many resources are going into that community, including the Downsview Arena, which was opened up recently with Humber River Hospital, as I mentioned before, and there'll be pop-up community clinics available as public health units have the resources and the vaccines to go into those communities. They're moving around, and the vaccine availability in those communities will be advertised locally to the people in those communities when the clinics are going to be there. I've read also today that they have been knocking on doors in some communities and bringing people down, and that's what's going to happen. We're getting out there as quickly as we can to all of those communities when we have the vaccine supply. Thank you.